P1 variant, the variant first identified in Brazil, is being found increasingly in outbreaks in both Alberta and in British Columbia. And Michael Serapio is looking into that specifically for us. On Alberta, number one, since we were just listening to Rachel Notley from yesterday, what are provincial officials saying in Alberta about the P1 strain, Michael?
Well, they are giving more details on an outbreak that was first reported over the long weekend, Heather. Initially only described as a significant outbreak tied to the P1 variant. We now know through tweets from Alberta's Chief Medical Officer of Health that the outbreak is tied to one traveler from out of province and is now linked to a major employer in the province itself. Now, that employer is PTW Energy Services, and the company itself has confirmed that 3 employees have tested positive for the P1 variant, people who worked at its Drayton Valley, Edson and Hinton offices. The company now reaching out to a third party for a comprehensive review of the situation. And as for comment on this outbreak, take a look at what Dr. Dina Hinshaw put out on Twitter. She says, "We have now identified 26 COVID-19 cases linked to employees at these 3 sites and their household contacts. So far, only 3 are confirmed P1 cases, but this will likely increase as more results come in." So likely increase, and that is worrying because we know that the P1 strain is more transmissible, and unlike other strains, it can evade an antibody response, which means a person who had COVID-19 and has recovered, as was seen in the past, might still get reinfected, and mutations within this strain may also make vaccines less effective against it, which is why Alberta Health is now on higher alert. And Heather, we should also point out, in addition to those 3 cases, officials are also investigating a separate P1 case in the Calgary Health Zone as well.
So those 2 areas, 2 workplace outbreaks of concern to officials in Alberta, and at least in one of them, out of province travel related. So they watch those situations and the numbers mounting there. British Columbia has a huge issue with this particular variant. What is it dealing with, Michael?
Yeah, you're right to use the word huge because British Columbia is the epicenter of the P1 variant outbreak in this country. 370 cases of the variant have already been identified by provincial health officials. And given how quickly it spreads, it is believed that more will be found. Now, one researcher that CBC News spoke with says she believes about 20% of all variant cases in BC are tied to P1. And just last week, health authorities did shut down Whistler Blackcomb, bringing about a 3-week circuit breaker for the ski resort as officials tried to curb the spread. Now, officials still don't know exactly how the variant is spreading, but they know it is sending more young people to hospital, and it is affecting the Vancouver Canucks as well. Half the team's players currently have COVID-19. Several have tested positive with the P1 variant, and like in Alberta, this is very alarming, not helped by the fact that while British Columbians were urged to stay at home during Easter, Heather, many were out and about this long weekend.
Michael, thank you very much. Michael Serapio taking a look at the P1 variant and setting up our next conversation. Dr. Darren Markland is back with us. He's an intensive care physician and nephrologist based in Edmonton, Alberta. So we look to the Alberta story. And Dr. Markland, welcome back to our program.
It's nice to be back.
You were listening, I know, as Michael was discussing the P1 variant first identified in Brazil. I'm interested in your take on all of this, how in particular it differs from other strains, and what are the features about the P1 variant that most concern you?
Well, Michael's very accurate in what he's telling us. P1 is a coronavirus, but we think it spent a fair amount of time in a particular group of immunocompromised hosts, and during that time refined its ability to infect us significantly. The original wild-type coronavirus was kind of like a poorly cut key. You had to jiggle the lock a lot before you could open the door. This is perfect. It takes very few viruses to actually get into our body, and because of its efficiency, it can infect a significant number of cells at the same time. So it's more like instead of getting hit by a Skoda, you get hit by a Mack truck. And as a result, we've seen, at least in my business, which is critical care, what happens when massive traumas happen, or at least massive inflammatory syndromes. And this is likely why we're seeing significant more morbidity, as well as younger people coming down with more severe manifestations of the disease.
Spreading more easily, as you said, and explain why. But can I also ask, one of the things that I've been reading about the P1 variant is that it may reinfect people who have already had COVID-19 and who should have some degree of immunity. Now, what does that tell us, and how much more worrisome does it make it?
It makes things significantly more complicated. While it may infect us, we don't have good data on the severity of secondary infections. There's thought that secondary infections may be more mild. But that means, from a hospital perspective, that we can no longer put all coronavirus in the same place. And that's taxing on our resources. We now have to isolate our patients until we know whether or not they are wild type, B117, or the P1 variant, because mixing them can cause reinfections and secondary contamination and outbreaks in our hospitals.
And what impact could all of this have as far as P1, Dr. Markland, on the vaccines?
Well, the vaccines are effective against P1. And when you listen to a lot of the news behind its ability to escape vaccination, those are studies based on test tube studies for the most part, where they look at antibodies and see how effectively they bind. The immune system's much more complicated in a person. We don't just have antibodies, we have T cells and other effectors. So the real data is going to come through studies after vaccination. And vaccination immunity looks far more robust than the natural immunity from the original infections.
Okay. Some of the details, I mean, Michael was laying out some of them, what we know of the clusters in British Columbia and in Alberta, and I'll just limit discussion to Alberta for the purposes of this conversation, but these two workplace outbreaks, one in Calgary and a separate series of outbreaks in 3 different facilities within one other company, PTW Energy Services. So we know it's a workplace situation. We know from Dr. Hinshaw, Dr. Markland, that it's linked to out-of-province travel. As we get further details about these P1-related outbreaks, what is of interest to you? What is catching your attention about them?
Well, early in this pandemic, there was arguments about airborne versus droplet spread. And that was a nuanced argument. But with the increased infectivity, because it takes less virus for this to spread, this is going to act more like an airborne virus. And therefore, it will spread very quickly. We see 100% of household contacts get this instead of significantly less with the wild type. And that means enhanced mechanisms of safety and protection have to be used in the workplace. And that may include things such as N95 masks when you can't physically distance greater than a meter apart from your coworkers.
So that is one of the measures needed. You were listening to Rachel Notley speaking yesterday, saying the Kenney government needs to do much more in the face of these numbers and in the face of these variants. Going back, maybe she suggests to January and the tighter restrictions that were in place then. What do you think needs to be done right now? I was mentioning the Emergency Management Committee is meeting this morning. If you were at that table, what would you say?
Well, the tough part is that, I did this interview in November and I said the exact same things in November. To do the same thing as we did in last November and expect a different result is insanity. Toronto is now overwhelmed with respect to their hospital and intensive care units, and that's going to be happening here in Alberta. And any delay in instituting much more firm measures will result in unnecessary deaths.
Plain and simple. You're right. I remember that conversation. It was pretty stark what you were saying. And when you were speaking just a few days ago with John Northcott on this program, you were equally sobering. You were talking about how this is going to be like the second wave, but worse, and saying that Alberta has really just a time frame of sort of a couple of weeks to get things in order. We're a few days into that 2-week period since your last conversation with John. Has anything you have seen revised your prediction at all, Dr. Markland?
No, I don't think so. This is the perfect storm in that these variants are highly infectious. It's spring and people have spring fever. There's considerable COVID fatigue. And the vaccines have given people a false sense of security. Everyone has a friend or a loved one who's got a vaccine, so now we think it's okay to go out, get around. You combine that with political inaction, very similar to the last situation. And we're going to see now younger, sicker people. And the people who die now will be leaving a lot of very quality life years behind.
Dr. Markland, we'll check back with you again. You always paint such a vivid picture of what's going on in your hospitals and in your province. Thank you, Dr. Darren Markland from Edmonton.